I'm going to talk about the transmission reduction and prevention with HPV vaccination study. It is unclear whether vaccination against HPV effectively protects sexual partners of vaccinated individuals. So I can see here. HPV transmission, it can be investigated in couple-based studies. In addition to individual-based studies, a couple of based studies, they can capture information about the transmitter and the HPV infection. And one population that may be optimal for studying transmission dynamics is those in recently formed relationships. And this is because transmission is likely to occur at the onset of sexual activity. And the only couple-based study that has focused on those in recent relationship is the HPV infection and transmission among couples in heterosexual relationships, or the HITCH study, which our group has conducted. Just recently, it has provided some evidence that there is a transmission reduction via vaccination. However, I think Dr. Franco mentioned earlier to me that only 10% of the women were vaccinated against HPV. And on top of that, there's evidence. Yeah, and it was an observational study. To this point, there's no randomized controlled trials on the reduction of HPV transmission in couple-based studies. So I present to you our study, the transmission reduction and prevention with HPV vaccination, or as we call it, the TRAP HPV, and we're very proud of this study acronym because of its inhibitory nature. It has been registered on the clinicaltrials.gov, and the objective is to determine the efficacy of an HPV vaccine in reducing transmission of genital and oral HPV infection to sexually active heterosexual partners of HPV vaccinated individuals. The intervention vaccine we're using is the Gardasil 9 from Merck. The placebo vaccine is a hepatitis A vaccine, a vaccine by Sanofi Pasteur. And because it's a couple-based study, we have a 2x2 factorial design, and this allows for 4 comparison groups. In the one condition, I can't talk about. So in the one condition, we have the male and the female vaccinated with Gardasil, and then we have 2 discordant conditions where the one where the female is vaccinated with Gardasil 9 and the other with the hepatitis A vaccine, and the other discordant group vice versa. And then we have the placebo condition where both male and female are vaccinated with a vaccine. We need 500 couples for this study. This is determined via the Bernstein-Lagakos approach, which has 90% power, type 1 error of 0.05, one-sided hypothesis for reduction is about 40% rate of transmission, and we assumed cumulative 16% loss to follow-up at month 12. This is based off of previous studies we've done, like HITCH. And so the month 12, because we follow them participants up for 1 year. The eligibility criteria. 1, not have been vaccinated with the intervention vaccine, plan on remaining in Montreal for at least 1 year so we could follow them up. Be in a new relationship that starts no more than 6 months prior to study entry. So this is our definition for a new relationship, 6 months. Plan on having continued sexual contact with partner. Be between 18 and 45 years old. Have no history of cervical, penile, oral, or anal cancers, and be willing to comply with study procedures. One example is that we ask couples to refrain from sexual activity 48 hours before a study visit to minimize the risk of contamination. We have started recruitment in January 2014. We have many recruitment strategies, as we can see here, and the most effective one has been posters around McGill and other places in Montreal. Traditionally, study coordinators, they'll ask potential participants at screening or enrollment eligibility, the eligibility criteria. We decided to complement this approach by providing potential participants with an online pre-eligibility questionnaire. After they fill it out, our coordinator gets in touch with them. The important time points for our studies is 0, 2, 4, 6, 9, and 12-month marks. For the Gardasil 9, they're vaccinated the 0, 2, and 6 months. For the vaccine hepatitis A, there's only 2 doses, and this occurs at the 0 and 6 point marks. For this reason, at the 2-month mark, we administer a saline solution so that participants don't know which arm of the trial they are in. At all time points, we measure oral, penile, and vaginal samples, and same thing with self-administered questionnaires. And at enrollment, we obtain blood samples, and this is to assess for neutralizing antibodies. For the HPV testing, we use the Master Pure Extraction Kit, that's for the DNA extraction. For the HPV genotype typing test, we use the linear array, which detects 36 HPV types. It uses PGMY0911 consensus primer system targets, and it targets the L1 gene. These study outcomes: reduction of HPV infections with target HPV vaccine types in multiple anatomic sites in the vaccine-administered sexual partners of HPV vaccine individuals, and also reduction in HPV type concordance available as per the group contrast, which we see below. We will take advantage of advanced regression methods as a framework for measuring the effects expected via HPV vaccination. We'll use Kaplan-Meier to plot the cumulative probability of HPV infection in sexual partners of vaccinated versus unvaccinated individuals against follow-up time. We'll use a log-rank test for statistical comparisons in HPV transmission between vaccine and control groups. And we'll use additional cumulative risk models fitted with type-specific transmission as an outcome. Like generalized estimating equation models will be used to incorporate data across multiple HPV types to account for repeated HPV prevalence data across types instead of it's involving the same subjects. So strengths. This is the first randomized controlled trial to investigate HPV transmission reduction via vaccination. Few couple-based studies have recruited a target size of our intended size. We have 502 from the Hitch study, which I mentioned earlier, and also one Chinese-based study, which had 874 couples. They were married couples. And TRAP-HV could provide empirically derived estimates for health economic models and mathematical models predicting herd immunity. And so I mentioned that one pro of a couple-based study is that you can capture information about the transmitter of the infection. One challenge is recruitment, and we've made a few amendments to help our accrual rates. For example, we've increased the upper age limit, increased from, at first it was 26 to 40 years old, and once more to 45 years old. Our compensation, it's increased from $350 to $500 per couple, and we've raised it once again to $1,000. Collection of anal samples discontinued. This is because our recruiters in the field, with discussions with potential participants, they had mentioned that this was a deterrent for potential male participants, so it has been discontinued. The Gardasil, it's been replaced with Gardasil 9 as an intervention vaccine. The purpose of this was to increase the efficiency of determining the study's outcome, and also for the increased benefits to participants. Havrix by GlaxoSmithKline has been replaced with the vaccine Sanofi Pasteur as a placebo vaccine, just due to availability. And right now we are writing the manuscript, and this is the concert diagram as it is now. We've had a number of ineligible couples, 160 randomized. For the partial FU, that means the follow-up. Yeah. Then I think that, yep. Is there anything else you want to say for this one? No, because I think that's about it. So and I'll leave everyone with the acknowledgement slide, and thank you for your time.